One of the biggest issues everybody's talking about today is healthcare and the lack of it. If there was lots of it, it wouldn't be an issue. Dr. Rose Zacharias is the president of the Ontario Medical Association, practicing doctor. She joins me right now because I want to put the question to you. Your experience, you were in an emergency room. In the 60s, 70s, and 80s, universality worked. Most people seemed to have the healthcare they needed. Why is it all falling apart now?
So we've had gaps in the healthcare system for a long time.
Right.
The pandemic exposed those gaps. There are chasms where there used to be cracks, and we're experiencing
So it exacerbated it, but it was there before.
Absolutely.
So why was it there before then?
So physicians have always been high capacity, compassionate, intelligent caregivers, and yet they are working inside a system with some serious fractures. There's disintegration, there's poor coordination, and we haven't really addressed burnout when it started, and now it's overblown, and it's resulting in
So that's just, okay, so what you're focusing then, doctor, is numbers. We don't have enough doctors. Is it as simple as that? If we had more medical schools, if we had more practitioners coming from other countries and licensed, would that be the end of it?
So right now we don't have enough doctors. We don't have enough nurses, and we need to address that. So we welcome the government's announcement about increasing medical student spots, increasing junior trainees, reducing the barriers for those physicians who are ready to practice but trained outside of Ontario.
Was there a lack of foresight? Is that why we're in this pickle without not enough doctors? Is it because either the profession or the schools or the government said they should have said 30 years ago, we need more doctors?
So there's another really important point to make here. We need to let doctors be doctors. I've been a doctor for 20 years, and to practice medicine is different now. The expectations on physicians are huge. The documentation, the administrative burden that's required of doctors takes them away from patient care.
Why do we have that extra administrative burden? Is it more bureaucrats who are saying we got more documentation?
So there is a medical legal responsibility to capture important information.
Right.
And as technology has been introduced, technology hasn't really kept up with how fast doctors think, how quickly they're required to communicate, and how integrated they need to be as a member of the team with the pharmacist, the psychotherapist, the diabetic educator. And so the technology has really taken doctors away from their patients and put them in front of computers, and that's wrong.
So, Dr. Zacharias, you're telling me that technology, while it may, in the short term, seem to make things easier, it hasn't. It's actually bogged things down.
So the pandemic actually introduced virtual care. We need to now leverage what we know of technology to enable and equip and empower doctors and all healthcare team providers to provide better care. But it cannot be a distraction from patient care.
Learn to live with it. Thank you very much. 3 minutes. Please stay tuned to keep informed about the latest policy issues. We all need to sharpen our game, because if we don't, we could end up with another Justin Trudeau government, and we don't want that. So please subscribe, tell your friends about the show, and if you can, PayPal, because that guy behind there, he wants to get paid. He does a very good job.